You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
In general, the patients who need eyelid surgery, one of the areas that we have to look at in the position of the eyebrows, because if the eyebrows are too low, can actually create fullness in the upper eyelids or redundant skin in the upper eyelids that actually is because the eyebrows are too low rather than eyelids having too much skin. So again, those of us who are experienced in this area, we take that in consideration. And there are patients that may just need an eyebrow lift rather than eyelid surgery. The patients that they need eyelid surgery, there are patients who need combination in order to have the optimal results. So that's an integral part of what we analyze. The other factor, the other combination surgery that we do with the eyelid operation is facial rejuvenation, other parts of the facial rejuvenation, meaning tightening of the skin of the face, tightening of the neck, removal of fat. And sometimes, again, we do use laser in the lower eyelids or the entire face to improve the quality of the surface of the skin. The function of the laser is almost like what we get from painting of the building after renovation. If you renovate the building, if you don't paint, it's not going to look great. So in the eyelids also, we have the same factor. And if we make it smoother, but it is still discolored or has fine wrinkles, laser is going to take care of that. Most of us who specialize in the face area have variety of lasers. And depending on what the condition is, our choice is going to be different. And for the lower eyelid, generally the need for the laser is because of the discoloration or fine lines. And the best laser for that is the CO2 laser. We can get, obviously, improvement from the Cytons, Halo, profractional, and even from Morpheus 8. But they don't accomplish exactly what the CO2 laser is going to do in the lower eyelids, which is a combination of erasing the discoloration and removing the fine wrinkles. And the laser can actually be used at the time of eyelid tightening and or removal of bags, as long as we don't do what we call skin flap technique. There are two major surgical ways of tightening the skin of the eyelid. One is raising the skin and muscle, which is muscle that closes the eyes, called orbicularis muscle. And the other one is raising the skin alone and lifting and redraping, removing the redundant portion. As long as we don't do the skin flap only, laser can be used. But if your skin flap is raised as a separate entity, delivery of the laser will be slightly more risky in terms of delayed healing and loss of skin. So it is something that we don't commonly do. The benefits of not dividing laser delivery and surgery is that there is only one surgery, one recovery, because usually for the eyelid surgery, we need some anesthesia. And if we also deliver CO2 laser, we need anesthesia. So if we divide them, there'll be 2 recoveries, 2 procedures, and 2 startup anesthesia and facility costs that they can be combined if we do them at the same time. For a consultation about blepharoplasty, you can call my office, 440-461-7999. Again, 440-461-7999. Or go to our website, and that is Dr. Bahman Guyuron, one word, .com. And we'd be happy to offer in-person or virtual consultation overwhelming majority of my practice is from out of town, out of country patients.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.